Namaste, I'm Dr. Sujata Pawar. So let's understand about various fertility treatments usually recommended. So when a couple is planning for conception and they don't succeed naturally, they approach their doctors, gynecologists. So there's a set of treatments advised. So initial line of treatment is installation of various hormonal injections. These are all artificial hormones and or hormonal pills or hormonal supplements or hormonal ointments are recommended. Along with this, the ovulation study is done, follicular monitoring is done, and your cycles are tracked. If it does not succeed, you're recommended for IUI. IUI again is done for a set of 3 to 4 to 5 cycles, along with the hormonal pills, hormonal injections, and hormonal supplements or hormonal ointments. Another 3, 4, 5 cycles. If it does not succeed again, you're recommended for IVF. IVF again is followed with certain hormonal injections, hormonal pills, ointments, and again if it does not succeed, you're recommended again for further IVF sessions, or sometimes the embryos are frozen and you are accordingly advised for certain IVF sessions or for the embryo implantation. If the endometrium thickness is not satisfactory, they will again track the ovulation and they will again instill with certain medications or hormonal pills and hormonal injections, and then whenever it is satisfactory, you are advised for the embryo transplantation. So basically these hormones which are instilled into your body by various ways, it could be injectables or tablets or ointments. So these are artificial hormones. If they are consumed for a longer duration, they interfere with the body's natural hormonal production, leading to further ailments or further disorders. Apart from that, these also enhance the ovulation process. It means that during a menstrual cycle, the ovaries release 3 to 4 to 5 ovum in each cycle. मतलब स्त्री बीज जो निर्माण होते हैं, रिलीज होते हैं, they are 3 to 4 to 5 in number. But when you take those artificial hormones, that ovulation is enhanced in the sense that during one cycle, your ovaries may release around 50 to 100 to 200 to 300 to 500 ovum, मतलब स्त्री बीज, which is definitely not natural, which is artificially released because of all those hormonal injections and pills, and it can lead to further problems. इसको कहते हैं frequent ovulation. Frequent ovulation is definitely not recommended. It may lead to certain problems. इसको repetitive हम लोग frequent ovulation कहते हैं. This can also lead to infertility in future. This can lead to ovarian insufficiency. अब बार बार जब आपके ovaries ovum को release करते हैं, in a female's lifetime, in the female's menstrual cycle का जो एक span होता है, there's a fixed number of ovum which can be released, and these are released slowly and steadily in every menstrual cycle. But during the process of all these hormonal pills and injections और IUI, IVF के process के time पे multiple ovum is released, जिसकी वजह से ovarian insufficiency further और बहुत ही जल्दी females में आती है, जिसको early menopause कहते हैं, और इसीलिए आपके जल्दी जल्दी AMH levels drop होते हुए दिखाई देते हैं. Most of the females complain कि मेरा AMH पहले 4 to 7 था, and after I took those hormonal medications and pills, it dropped to 0.118 or 0.7 like that. So AMH levels are dropped because of this process. So it is definitely not recommended according to Ayurveda. So why are these hormonal injections instilled, and do they really work, and do they have results? So talking about statistical results, IVF, IUI has around 25 to 35% of success rate, and after taking so many medications and pills, there's definitely a negative impact on your body. So when you consume hormonal pills or hormonal injections for a longer duration, you may have certain adverse reactions like mood swings, lethargy, you may have depression, you may have anxiety, you may have nausea, vomiting, headache, cramps, breast tenderness, bloating, you may have upset stomach. Ovarian hyperstimulation syndrome is a problematic thing to happen. इसमें enlargement या hypertrophy of the ovaries happen. The ovaries की size बहुत ज़्यादा बढ़ती है, and it is characterized by cystic enlargement as well. It can lead to multiple births, जैसे twins है, triplets है, ऐसे multiple births हो सकते हैं. Increased risk of pregnancy loss, hot flashes, edema, swelling of breast, vaginal spotting between your periods, risk of blood clots, and forming blood blockage in the blood vessels, that is thromboembolism, etc. So these are the various problems which can be created because of continuous usage of hormonal pills and injections for a longer duration. So let's understand what is the solution for all these things. Most importantly, according to Ayurveda, let your body do its own work. If you feel there is certain obstruction or certain causative factors which are blocking the natural process of conception, you need to work at that process. So if you're obese, if you have PCOD, if you have diabetes, if you have thyroid, if your AMH is low, if you have hypothalamus dysfunction due to stress और unsatisfactory male parameters है, male parameters बहुत important criteria होता है. अगर मेल जो स्पर्म के जो काउंट है, इफ़ इट्स नॉर्मल, दैट्स नॉट द ओनली रिक्वायर्ड क्राइटेरिया व्हेन इट कम्स टू नेचुरल कंसेप्शन. द मॉर्फोलॉजिकल स्टडी, द एनाटॉमिकल स्ट्रक्चरल स्टडी also has to be good. The motility, vitality, viability of the sperm has to be good. And if it's not good, they are corrected with certain Ayurvedic medications and Panchkarmas, and accordingly we proceed with the treatment. Apart from that, damaged fallopian tubes, endometriosis, or if you have a history of past ailments, जैसे आपको पहले कभी भी डेंगू, मलेरिया, टाइफॉइड, कोविड वगैरह कुछ होके गया है, तो पहले we have to make sure that we are treating the imbalances happened because of that particular ailment, and then you have to proceed ahead. So Ayurveda helps treat infertility and helps with natural conception. But as always, I have said this in my previous videos, my articles also, that you have to see what are the causative factors. There's nothing called unexplained infertility. Just because you want to conceive, it does not mean that you have to treat your body with artificial hormones or artificial supplements. You have to make sure that your body is naturally secreting hormones, and just by simple changes in your lifestyle, like sleeping by 10:30 at night, waking up by maximum 6:30 a.m. in the morning, having moderate diet, avoiding junk food, exercising on a regular basis. Yogasanas also play a major role to balance your bodily organs, your hormones, and your chakra balance as well. So Yogasana is also one of the good form of exercises. Avoid any kind of artificial supplements, lots of protein powders, or any kind of vague rigorous diets, excessive protein consumption, excessive butter and cheese consumption. It is a complete no according to Ayurveda. Make sure you're having lot of natural supplements, in the sense natural food resources, have lots of green leafy vegetables, fruity vegetables, have homemade prepared, freshly prepared food, have cow's milk, cow's ghee in your food. Make sure you are eating your dinners before sunset, like by 6:30 to 7 you should be finishing your last meal of the day. Avoid junk food for dinners, and on a regular basis have it only for lunch if you want to consume, and have it once a week. So these are certain changes. And of course, if there is certain problem in your body, so Ayurveda and Panchkarma and internal Ayurvedic medications, Nasyam Panchkarma, Shirodhara, Uttar Basti, these are various treatments followed according to Ayurveda and explained by Ayurveda. They work wonderfully for natural conception, but try and correct certain basic things in your day-to-day life and let your body do its own job. You don't need any artificial supplements if you're following a routine, a proper routine, a good balanced diet and good balanced lifestyle. And you can definitely conceive naturally by taking little efforts on yourself.